So good afternoon, everybody. I'm Dr. Sonal. I'm working at Dr. Agarwal Eye Hospital, Pimpri, Saudakar. I have done my diploma after MBBS, diploma ophthalmology and DNB ophthalmology, and also I'm trained in medical retina. So I'm basically a phaco cataract surgeon and a medical retina consultant working here at Pimpri, Saudakar, Agarwal Eye Hospital. So today I am here to give you insights about types of lenses used in our cataract surgery. So what happens after maybe 50 years or 60 years of age, the lens in what we say in our eye, as the because of its age-related process, just like our hairs go gray with age, just like that, that lens will go on becoming white and white, and the people will say there are problems in distant vision, in seeing for the distance, and then they will have sometimes problems in the color contrast sensitivity. They have a problem in night driving and all, and then they come to us with all these symptoms, and then we diagnose them with the cataract. So now the cataract is there. So now the patient knows that cataract is there, but then after that, what about after cataract? So after cataract, for the cataract to have a treatment, is the option is only worldwide available is the cataract surgery. Nowadays, cataract surgery is available with the all the advanced lenses. There were in the past the cataract surgery used to be like a little bit complicated procedure, big incision, sutures, and it used to be without IOLs. Then came the concept of IOL, that is the intraocular lens. Means if we are removing a lens from the eye, we are replacing it with the artificial lens. So now with all these advances and all, there are multiple choice for of IOLs for the patients. So now then patients get confused like which IOL I should go for. So basically, I will first give you the insight about what all types of IOL we have. So to go as a broader spectrum, we have three types of IOLs. One is the monofocal IOL, second is the multifocal IOLs, and third is the extended depth of focus IOL, which is the newest concept of all. So first I will go with the monofocal IOL. Monofocal IOL is the age-old concept. It will have a single focus. Single focus means once you are removing the IOL, you are replacing you are removing your cataract lens, you are replacing it with the intraocular lens. So with this monofocal lens, you can see better for the distance. It will not cover your near vision or the intermediate vision. Basically, when we are seeing with our normal eyes, our lens, the natural lens, which is the God gifted to us, it can be like this with its own properties. So when we are looking at the distance, it will be like this. When we are looking at our near, it will be like this. So you can see better for even distance and near. As our age will increase, this near vision quality will decrease because of some muscles in the eye which are working for this moment. They get fatigued with the age. So you have a glasses for the near vision. We have a presbyopia for this. We have a name as a presbyopia for this. So when you are removing this natural lens and putting a monofocal lens, you can see better for the distance. And for near vision, you will wear the glasses just like you have a glasses for presbyopia. After 40, whatever glasses you have, just like that for near vision, for reading purposes, for the females who are working at home, their small works which require near vision. For that, they will require to use the near vision glasses. So monofocal lens. So this is first is the monofocal lens. Then comes the multifocal lens. So with monofocal lens, then people came like we want to see with same lens for distance and for near and for intermediate. So then scientists came with the newer concept like multifocal lens. So what this multifocal lens will have, just like monofocal lens, it will have a single plane only, but it will have a different words on that, which will have our powers for distant, intermediate, and near. So they will be placed according to the upper pupil size. So with this IOLs, patient can see for the distance, for the near, and even for the intermediate without glasses. So they need not use the glasses even for the near vision. Then comes the concept like EDOF. Why this EDOF has come? So basically, when we are going for the multifocal lenses, we are trying to replicate the lens which is given by the God. But when we are making the similar products, we are not 100% up to that point that the lens which can be like this. So what happens in the multifocal lenses? We have these different walls of different powers. So the people who are having night driving, the people who want to have a nice color contrast in their work profile, these people started giving complaints like they are not able to in the night when they are having a night driving, they can see those walls and they are having disturbances because of that. The color contrast sensitivity is little less with the multifocal lenses. So what happened with this? The scientists came with the newer concept like a PDOF lens, that is an extended depth of focus lenses. So what this extended depth of focus lens do? Basically, these lenses will cover your distant vision and the intermediate vision. Intermediate vision means almost if you are 40 to 60 centimeter distance. So whenever they want to read at a distance of their reading distance, that is what we say at 30 centimeter distance, they will require to wear the glasses that will be just 1.5 or like that for the near reading. Rest all work they can do without their glasses. So what they have done is they have minimized all these symptoms like with extended depth of focus, patients do not have problems in the night driving. They do not have problems like color contrast and color contrast sensitivity loss and all. So when the people who are actually in the range of 50 to 60 years, they do have their active work life. They have to work at their workplaces on laptops and all. They have to have night driving in their active life. So for them, this extended depth of focus is working as a miracle because it is having all the properties like multifocal. Just for near vision, they need to wear the glasses, which is not a big deal. They can read at a distance of intermediate. If they place their reading material at a distance of maybe 40 centimeters, they can even go with that also. And if they want to have a near vision, perfect near vision for at 30 centimeters, then they can have a just near vision glasses. So this is working as a miracle for all these patients because their laptop distance, that what we call it as a intermediate distance, it is clear without glasses. So these are we say as a wide basis. These are three types: monofocal, multifocal, and extended depth of focus. So now with all this, we do have advances in all these also. So in monofocal, we have advanced monofocals or what we call it as advanced monofocal. So in what we have advanced monofocals means what? So in this monofocals, what do they have in advanced monofocals? They have a yellow coated. So what this yellow coated or yellow lenses do is they will protect your retina from the blue rays. It is said that blue ray of the array of the lights is a little bit harmful for your retina. So as the age increases, this harm is little more. So what these the yellow colored lenses will do, they will protect your retina from this blue light. So these are yellow lenses. Then some lenses are like, they have a property like they will have a more distant vision and almost till the 60 centimeter distance, they do have a vision. So they do have a little bit property of extended depth of focus. They don't have total 100% like extended depth of focus, but they do have at least till plus one addition they have. That addition is very gradual from the we have an ion which is circular. So from the periphery in the center, there is a gradual increase in the power, just like progressive glasses we have. So these are called as advanced monofocals. So these are monofocals, but they do have a property of little bit of enhanced intermediate vision also. So these are called as enhanced monofocals or advanced monofocals. Then in the monofocals, again monofocals and multifocals, some people do have a cylindrical power. What all we lenses we till now what we talked about these are for the people who are not having the cylindrical power. But sometimes patients do have a cylindrical power. Why the cylindrical power patients are having in their spectacles? Because we have our cornea, that is the front surface, which is the refractive surface of our eye, which should be a circular, but in some patients it is not circular. It is more curved in one surface than the other surface. So these people do have cylindrical power. So if these cylindrical power are above -1, or to be specific, -1.25 or -1.5, then we have to have that power also included in these lenses. Because otherwise, what will happen? These lenses will correct their power of the eye, which is due to that is the spherical power of the eye. Even if you have a -5, -6, these can be adjusted in this monofocal eyeballs so that you need not wear the glasses for the distant vision. But if you have this cylindrical power, then you need to have this cylindrical power also in your eyeballs. So what lenses we have for this? These are the toric lenses. Toric lenses will have that cylindrical power also in that. So for these patients, after doing cataract surgery, they will not need to wear the glasses at least for the distance. If we do have a this toric options in monofocal, we do have this multifocal torics, and we do have this EDOF torics also. So all these patients who are having cylindrical powers, they do have now options of toric lenses. Those patients who are having this reading that what we do pre-operatively, like keratometry reading, whenever we are calculating the IOL power, we do look at the keratometry readings. And if these keratometry readings are more than 1.5 to be specific, then we tell the patients to go for these toric lenses to have a perfect distant vision, at least with the monofocal toric lenses. Then, and if they are opting for the multifocal toric and EDOF toric, then they will have this toric power in these lenses also. So they will have a good distant vision also and good near vision also. So they will not need to wear the glasses for the distance and the near also with these multifocal torics. So these are the types of lenses nowadays we have. Now after this, if we are talking about some people who are cataract is there, but what we say the normal natural lens, the support of the lens is not good. Then sometimes what we say that our lens it is nicely supported in our eye, and what we do is we remove the cataractous material from this bag and we put the lens in this bag. If this bag support is not good, then we do have different types of lenses for these patients. We do have a iris flow lenses. What this iris flow lenses mean? We have a black colored iris in our eye. So if we don't have the support, good back support, we are having the lenses which can anchor on this iris. These are called the iris flow lenses. Sometimes patients will have history of trauma or anything like this. So because of which this support is not good. Then we put this iris flow lenses for this. Or otherwise, what option we have? We have a sclera, like after cornea, we have a white color that is the sclera. We can anchor these lenses to this sclera also. These lenses are called as the sclera fixated lenses. So what we do is we suture or we just stuck in over there. So these are called as scleral fixated lenses. So whenever patients are not having the good back support, we do have options for these also. So nowadays with the modern surgery, we are not making any patient affected. Rather, we are not leaving any patient affected. Those who are having this lack of back support, though these patients also we can operate with this iris flow or sclera fixated lenses. Sometimes we may need the help of vitreoretinal surgeon for this, but we do have options for these patients also. So to summarize, in the modern day technologies, what all options we have a monofocal lenses. In monofocal lenses, we have normal monofocals, we have enhanced monofocals. So in enhanced monofocals, we have yellow lenses. We do have toric lenses. We do have a little bit property of extended depth of focus lenses. And now we have two in the monofocal or any type of lenses. We do have two things. One is hydrophobic and one is hydrophilic. So what do these two meanings mean basically? So hydrophilic means these sub lenses. Whenever we are putting these lenses into this bag, after sometimes this bag can get opacified or these can have a jali, what is called in Hindi or Marathi. So we can have this opacity over here. So this formation of this opacity will also depend on this material like hydrophilic or hydrophobic. It is said that in hydrophilic material, this formation of the PCO, that is posterior capsular opacity, is more. With hydrophobic lenses, it is less. So these two things are also again in that hydrophilic and hydrophobic. So we do have these both the types of lenses in these things, hydrophilic and hydrophobic. So this is about monofocal lenses. When coming to the multifocal lenses, with multifocal lenses, we can see distant, intermediate, and near things here without glasses. But these lenses do have their own little bit what we can say it is as a side effect or a what we cannot match with the God gifted lenses. They can have a problem in night driving. They can have a little bit problem in contrast sensitivity. They can have a photophobia. Photophobia means little bit of light sensitivity is more. When they are going into the bright light, the light sensitivity is more. So these problems with these multifocal lenses can have, but they do have a advantage of not using glasses. They do have their clear vision without glasses for all the distance. So a little bit of discomfort is there, but these people are happy because they do not like to wear the glasses or they do not need to wear the glasses for distance, for near, or for intermediate. And then coming to the extended depth of focus, those people who are having very active life, those people who cannot afford even the this night driving problem or even this small problem in color contrast sensitivity. So these people can go for this extended depth of focus lenses. So these lenses will have a good distance and till the intermediate region, and they do have a moderate quantity of near vision also. So they do have a, they can definitely read at the distance of 40 centimeters, and for 30 centimeters, they may require to wear the glasses of plus maybe 1 or 1.5, not more than that. So these are the types of the lenses. So now in this, we do have Indian lenses, we do have imported lenses. So depending upon the company and all this, we do have all this array of different lenses. So now patient can choose any of these lenses according to their needs. And sometimes we help the patient to choose with their active life and all. But sometimes what happens, patient is having diabetes or patient is having some problems in the retina. So with this, for these patients, if they are having any problems in the retina, so we do advise patients that please go for the monofocal lens. Why? Because your multifocal lenses, or to have this multifocal or extended depth of focus lenses, you need to have all your other eye structures, including retina and all, in the perfect position or in perfect health. If you are having a little bit problem because of diabetes, you are having there is edema or what we call it as a inflammation in your retina. Then or we can have this blood dots or blood clots in your retina. Then these patients do have less vision because of cataracts also and because of this retina problem also. So if they are going for the multifocal lenses, then they may not have the as good as vision as the other people who are not having diabetes or anything problem in their eye. So these patients then they are not happy that I have put the multifocal lens and still I am not having the good vision. Basically, the problem with their vision is because of their retinal problem, not the cataract or cataract surgery thing. So for these patients, we do advise them that do not go for the advanced lenses if possible. because your retina condition is not that good, but still if patient insists or patient is okay with that, then we are okay with the multifocal lenses also. But if patient is having a retina problem, then it is better to avoid multifocal lenses. They can go for good monofocal lenses and have a glasses for the near vision. So these are the little bit points for the iOS. For to name the iOS, there are too many companies and so many Indian and imported lenses available over there. So we can have any type of lens. So basically, to make it a little bit easier for the patient, those patients who are okay with the near vision glasses, those patients who are already using glasses after 40 and they do not have problem with the glasses, they can definitely go for monofocal lenses. Those people who are not liking the this glasses even for distance or near and they do not have much active life, they are in night driving and all these things are not included in their daily active life, they can definitely go for the multifocal lenses so that they can enjoy their life without glasses. And those people who are having the active life, they have to have all these things in clear so they can go for this extended depth of focus lenses. So I would like to have any questions regarding this, or maybe I can answer the specific questions. Yeah. So multifocal IOLs, as I already said, that multifocal IOLs you have power included in that. So basically, monofocal lens is a plain lens. The multifocal lens will have all the powers in the world format. They do have their different walls in that. So they the middle one, then intermediate one, then again. So depending upon your pupil size, as the pupil size will decrease or increase, they do have all these power gradations. So with multifocal lenses, you do not need to wear the glasses. So that is the first important benefit of multifocal lenses. So people sometimes females are there or whatever those who are working at the home. So they don't want glasses basically. So for these patients, the multifocal lenses is like a boon actually. So they can go for the multifocal lenses and they can enjoy their life distant, near, intermediate, all vision clear with eyewears only. They don't need to wear the glasses. This is the benefit of your multifocal lenses. Yes, it is possible to do a cataract surgery at 30-year-old also. Even newborn babies also can have these lenses, cataract lenses, maybe due to their genetic problem or birth defect, what we say. They do have cataracts. So we can go for the cataract surgery even at the 30 years old patients. The 30-year-old patient, whenever they are having cataract, it is not the age-related thing in that there are different causes for that, but what is basic pathology in that? Their lens is getting white. So we can remove that lens and we can put the lens for them. So it is not unlikely that 30-year-old patient cannot have cataract. They can have a cataract and we can operate this cataract and we can put very good lenses for these patients. Which progressive lens should be used? So progressive lens is basically a concept for the glasses what we are using. So progressive lenses, we whatever we use in the form of glasses. So these are called the progressive lenses, which have a power gradation from above to down, the distance, intermediate, and near. Progressive lenses, if you're using for the, if you're talking about the intraocular lenses, then there are two types, multifocal or extended depth of focus, or what we say in our newest concept is again a trifocal also. So trifocal will have all the properties of multifocal also, extended depth of focus also, and they will have a reduced uh, this night driving problems and color contrast sensitivities. money is not the criteria, which is the best lens and solution available. I suppose this question is about the intraocular lenses because we are not using solutions for the intraocular lenses. We are putting it surgically and they are inside the eye, so we do not need to change these lenses. So if money is not a criteria, definitely trifocal lenses or the extended depth of focus lenses are available. These are available in Indian companies also and in imported things also. So you can go any type of lens, whatever you want in this things. In the Indian lenses, we do have lenses like means we have companies like Apasami or Peer Groups, and in the imported lenses, we do have different types of lenses like maybe Abbott, Zeiss, Johnson and Johnson's. We do have all this array of lenses, and they do have all these types of lenses. Which type of lens is better for the cataract surgery? So as I already said, it depends on the patient's need, patient's age, and patient's willingness. So whatever is patients need basically, sometimes patients do need their near vision also good for this thing, then they can go for the multifocal lenses. If patient is like they are just sitting at the home, they are okay with the glasses, they can go for the monofocal lenses. Patients is having active life, they are having, they still have to have use of outdoor work also and all these things, then they can go for an extended depth of focus or trifocal lenses. I had cataract operation both ways, but one was with multiple lens is not well and big light sounds so difficult for my driving. Also, it gives great image. The patient was done that can be fixed. And next operation, I have prayed for the single and it's good with the living spectacles. Now I'm thinking of reflected and some multiple lens with the normal single lens. Though living spectacles, they what in other angles. So basically, whenever we are putting the lenses for the cataract surgery, we are putting it in a bag. So whenever we are putting it, we are putting it like it is to be put for the lifetime. So very few times we may need to remove that lens. But at that time, what happens is when in which bag in which we are putting this bag can get compromised because once we have put the lens, they can form there is strong adhesions with this lens in our body. So what we say that this lens becomes a part of your body. So if you are thinking now, almost 1 year has gone from the February 25th, now February 24th. So removing it and putting monofocal lens, this can be an option, but it can be a difficult thing also because if these adhesions are more and if you try to just scratch and remove the lens, this bag might get compromised. So, if this band get compromised, then the option remaining will be after removing this multifocal lens, will be a scleral lenses or the iris fixated lenses. So it depends on your condition. You have to get your checkup done, and it will depend on your surgeon's advice what to go for. The cataract operation is not repeated basically. You can go for this removing of lens and putting the normal lens, but it does have its own what we say the side effects or the effects, like this bag can get compromised because there are strong evidence with this bag and the lens once we have put after 1.5 month what we say to get this nicely fixed. So after this, it is nicely fixed over there. To remove it and to replace it with monofocal lens, it is definitely not an easy operation. It can be done, but it is not an easy operation. So lens which is the best lens practical and moderately priced. So what we have is basically, so depending upon practical and moderately priced, definitely these monofocal lenses are priced less, multifocal lenses in the middle range, and this extended depth of focus are nowadays it is the newest one concept, so they are the costliest one. So The symptoms when the lens can be changed, I suppose this is related to the cataract. So, the cataract, with the cataract, what symptoms patient will have? They will have a decreased distance vision, first of all. They will have a problem in, sometimes patients do say that whenever they are going into the light, they are having problem in reading. What happens is they have a cataract which is exactly behind their pupil. So because of that, whenever they are going into the light, this cataract is coming in between and they are having less vision in the light. Sometimes patients do have problem in the night vision. Sometimes patients cataract is light, they do have problem in night vision. Patients do have a problem in color contrast whenever they are having cataract. Patients do have a sometimes patients do have a good near vision after they have developed a cataract. This is what we call it as the second sight because the density of our lens is increased. So these people cannot see for the distance, but their near vision is good with these lenses. So this is also a symptom of the cataract. And after all these symptoms are there, then you can get operated for the cataract. In the olden days, there was a concept like until and unless it is fully mature, white cataract, till that time, no operation is to be done. But nowadays, with newer advances, with psychomedication, with these laser surgeries, we can remove the cataract even at the earliest also. Means patient is having a problem, then we can remove the cataract patients. And practical and moderately priced, as I already told, it particularly depends on the patient's bill, patient's capacity, and patient's needs basically. So if you want to have a very good lens, then you can definitely go for a very good lens. And also it depends on the retina condition or the other conditions of the eye also. So this moderately priced and practical, it has to be discussed with the patient and then we can decide basically. So a patient needs to understand whatever the lens he is putting, what all properties it is going to have, and if it is okay with that, then we can go with that lens. So it will not be like generalized statement that go for this lens. It will be depending on all these factors and it can be decided patient to patient basis. Each lens is suitable for the patient who suffers CRO and now has a reduced vision in the left eye, but separate needs to be operated in the both eyes. So for these patients, definitely, I think the monofocal lens will be better because what we say is multifocal lenses do have their best version when they are put in the both of the eyes. Because whenever they are looking at the near vision, they are looking with the both the eyes. So for multifocals to perform best, they should be in the both the eyes, what we say. If patient has already suffered CRO, so definitely retina will be weak. So they can go for good multifocal, monofocal lenses. And if cataract to be operated in the both the eyes, then good monofocal lenses in the both the eyes and with the glasses for the near vision will be a very good option for this. How can reduce eye number? So to reduce eye number, we do have what we say as a broader term as a refractive surgery. So in this refractive surgery, there are multiple options. Before this refractive surgery, what we do is we do the different types of tests. So what we are doing is in the refractive surgery, basically we are operating either on the cornea or we are putting the lens inside the eye. So what we are doing is before doing any of these procedures, we do measure the our what is the present condition of our cornea, what is its thickness, what is its shape, and depending on the measurements of all this, then we can go for a different types of the refractive surgeries. We do have LASIK, which is a blade with blade. Then we can have a LASIK without blade, that is a femto laser. What we say, then we have options like smile also. And sometimes what happens is your cornea is very thin. So in patients, what we do have options is PRP, we can have option. We can have a lens, what we say that intra-implantable polymer lens, that is the ICL lens. So what we do is in that, in our normal natural lens, it goes and sit on this normal natural lens behind your iris. That is what black point colored patterns we have in our eye. Behind that, it goes and sits on here. It is a very thin lens which goes and sit over there and it reduces your number. So we can reduce your eye number with all these things. So to reduce eye number, basically you need to wear the glasses, contact lenses, or go for these refractive surgeries. The bifocal lens visually past is what is the difference between an expensive lens and the basic ones? How can the lens affect the one eye continuity like color and depth perception? The bifocal lenses, what we call trifocal or multifocal, what did they have is the bifocal lens, which will have a good distance and near vision, and intermediate vision is also moderately good in these things. So basically, expensive lens and what is the difference between expensive lens and basic ones? So what we do have is the just like our pen we have. So we have a pen of 5 rupees also, and we do have a pens like if we are going for the expensive pens, Parker pen and all. We do have a different uh, manufacturer for this. So what is the difference between basic and expensive lenses? So the basically whenever we are putting this intraocular lens, we are putting or it is after calculating the eye power for the patient. So basically we are putting this like patient will have a good distant vision in this. So we are the aim for this is good distant vision with the basic lens. So with this, now then patients or people will come with the things like if you are already removing the lens and putting the lens, then why cannot we have different functions also? Like we should have a intermediate vision also. We should have a near vision also. So accordingly, all these inventions came, and then accordingly, these newer lenses came like enhanced monofocals, but whatever I told you, like they do have yellow properties, they are having hydrophobic properties, then they do have a square edges, then came like multifocal lenses, then in multifocal lenses also patients did have problems and they came with the trifocal lenses and extended depth of focus lenses. So these are very little bit advances in the normal lens, like if you are making it hydrophobic, then definitely its price will be more. If we are making it yellow lens, then its price will be more. If we are making it square edge means what? The lens whenever it is put in the bag, it's the back surface, it is square edge. So it will snugly fit with this bag. So that posterior capsular opacity or jala formation in this thing will be less. So all these things make a little bit differences are there, little bit advancements are there, and accordingly the price will depend. So this price is basically not means decided by the surgeon. It is decided by the company that we are having this lens at this price. So basically, all these small things will make the lens expensive than the basic one. And if you are operating one eye, then whatever problems or whatever functionalities are going to be there, they are will be affected of the operated eye only. Depth perception concept comes with this multifocal lenses and all. So if you are using multifocal lenses in the both the eyes, then depth perception or what we say is that the near vision is best for that patient. If you are putting monofocal in one eye and multifocal in other eye, so they can also read for the near vision also. But that near vision will not be as good as whenever you are having multifocal lenses in the both the eyes. So that is a little bit what we say by depth perception is a thing which is to be done with the both the eyes, and it is does not involve just your lens. It does involve your eye muscles and very complex things in the eye. So for all this, if you are having same lenses in the both the eyes, then definitely results will be better. That's the thing. This question will be answered by Kishore from the medical team.
Hello all. The first question was, which is the best lens, practical and moderately priced? Is it covered by the health insurance? So to answer this question, it depends on if you are a corporate employee. It depends like which is covered under insurance. Basically, there are two lenses which covered under insurance. The first one will be monofocal. The other one will be multifocal. What we can do is we have the number, we could arrange for a call back from the concerned team and have it answered for you.